I hear this all the time from primary care doctors. We don't give a shit if it's autoimmune or not because the treatment is the same.
I heard you mention Hashimoto's and your own struggle with it. And so I think that that's another big, big topic we need to talk about here. What is the likelihood if you are able to get that diagnosis from a doctor or from someone and say, okay, you do have a thyroid issue? Is it likely to be autoimmune? And would your doctor even bring that up to you?
So you're bringing up a layer that like isn't even in the conversation of endocrinologists or primary care doctors. They don't give a rat's ass if it's autoimmune. Listen to me. They don't give a rat's ass if it's autoimmune. And there's a huge difference between knowing that your thyroid is autoimmune versus not knowing. And the issue is that I hear this all the time from endocrinologists. I hear this all the time from primary care doctors, and this is how we're trained. We don't give a shit if it's autoimmune or not because the treatment is the same. All we're
Hmm.
trying to figure out is if they need thyroid medication or not.
True or false?
Wrong.
True or false? Is the treatment the same?
Wrong. Wrong, 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 Nit. Like totally wrong. There is a huge difference because here's the thing. What difference would it make for you, Anne? I'm going to ask you this question. Let's say you have hypothyroidism for 10 years. If you knew it was an autoimmune disease 10 years ago, and you understood that autoimmune disease is where your body mistakes a part of your own body as a germ and is actively trying to kill it. So it's a
Yep.
mistake in your own cells, right? Mistaken identity. Then it starts to mistake many parts of your body as a germ. So you become a sitting duck for rheumatoid arthritis, Sjogren's, multiple sclerosis, you name it. Once you know you have autoimmunity and you actually dig deeper and you understand, nobody with autoimmune disease have one diagnosis or one target. We have
Oh,
hundreds
yeah.
of targets. We are sitting ducks waiting for more and more and more autoimmune diagnosis to happen.
To
And
start
then on
piling
top
up.
of it, here's the deal. Your immune system is here not just to fight germs, it's here to protect you from cancer. So, listen, I mean, do you know, and I'm going to ask the audience this, how much more likely is a person with autoimmune thyroid to get thyroid cancer than somebody else who doesn't have autoimmune disease of the thyroid? Does anyone know? This is going to be really important, okay? How many times more likely will you get thyroid cancer if you have autoimmune disease of your thyroid versus someone who doesn't have an autoimmune disease of the thyroid? Does anyone know? Type it in. Oh, bingo, bingo. Winner, winner, chicken
It
dinner.
is.
I love this. Okay, must be an alumni. Somebody else has said, "Oh my gosh, I love these alumni."
See, you have
Thank
trained them
gosh.
so well.
Oh my god, they're the alumni are chiming in. We're getting like 20 people saying 10 times more likely. So here's the
It
thing.
keeps coming. But the doctors aren't telling you this at
But
all.
man, if you knew that this puts you at so higher risk, knowing you have autoimmune thyroid, you know with certainty you're going to get 3, 4, 5, 6 other autoimmune diseases in the next 10 years alone. Would and there's something you can do about that. Is that life-saving important information?
100%. And somebody just said their doctor told them they had Hashis, but that there was nothing they could do to fix it.
Bullshit. It makes me mad. Um, I'm sorry. That just makes me mad. I'm mad for them. Because here's the other thing. If that person has Hashimoto's autoimmune disease of the thyroid, that person is 10 times more likely to get thyroid cancer. And there are things that you can do, number one, to calm the autoimmune attack. And number two, there are things you can do to protect that thyroid from thyroid cancer. Is that important?
Wouldn't you want to do it?
Hell yes. And here's the thing for those of you who are interested in getting a thyroid checklist, if you want to know what the checklist is, just to give you guys an example, I have a checklist here on some of the most common thyroid symptoms, and I'm just going to list them off right now. And think about this, okay? And it just goes to show you guys how much of the population actually have low thyroid. Think about this fatigue, muscle weakness, body aches, restless legs syndrome, swelling or achiness in your joints, neuropathy, which is nerve pain. You talk about constipation, diarrhea, dry skin, eczema, rashes, hives, puffy face, thinning hair, outer third of your eyebrows are thin, enlarged, uncomfortable fullness here in your thyroid, goiters, nodules, and cysts in your thyroid, fullness in your neck, periods are heavier than normal, low libido, difficulty with orgasms, heart palpitations, feeling cold all the time, depression, anxiety, brain fog, insomnia, hoarseness, elevated cholesterol. I can go on and on. And if I'm describing you and you are identified with at least 4 or 5 of those symptoms, type it in chat right now
Yeah,
because
we
the
want to see it.
likelihood they actually have low thyroid is pretty much up there because how do I know? At least 90% of people coming into our program have been told their thyroid is normal. And through their training and through getting the right labs and through the functional ranges that we teach them, all the mechanisms we teach them, about 90% of the people in our program figure out they actually have low thyroid or one or multiple steps in thyroid hormone activation generation is broken.
But I think that that's a great thing because it's such an opportunity for people, myself included, because as you and I were talking and as we were reading through this list and I shared with you a little bit about my background when it comes to the thyroid, maybe it's scary at first for somebody to hear, okay, you do have autoimmune thyroid, but then it's an opportunity. It's an opportunity to be able to turn it around.
Boom. Comment in the comment section below and tell me what low thyroid symptoms you think you've been struggling with, or if you've been feeling dismissed by your doctors about your low thyroid symptoms. I would love to hear from you.